Alright, so my name is Jared. I'm a nurse practitioner student. We're just going to be going over some information, just kind of get a general history, look at those kinds of things, and why you came in. So, what's your age?
I'm 24.
24, and what do you identify as?
In terms of gender,
Yes.
cisgender female.
Okay. And what is your ethnicity?
I'm white.
And what is your date of birth?
8/29/94.
Okay. And your name?
Amanda.
Okay. Also, who's the president?
Donald Trump.
Okay. And the day of the week?
It is Tuesday.
I would say you're oriented times 4, so I would say you're a reliable candidate to get information from. So what is the reason that brought you in?
Just a general checkup.
Okay. All right. When's the last time you had a physical exam or a checkup?
Probably back in high school.
Also, it's been a while.
Yeah.
Okay. Do you remember the results from that exam?
I think everything was fine.
Nothing stands out to...
No. Nothing I can remember or think of.
Okay. And how do you view your health?
I think I'm in pretty good health.
What do you mean by that?
I mean, I don't have any big problems that come to mind. I work out, I eat healthy, so I take care of myself.
Well, that's a good thing. What do you do? You said you work out and you eat healthy. What other health strategies do you have?
That's kind of it. I'm not the greatest at taking care of my mental health, but
Okay. Okay. But you said you eat pretty well.
yeah.
What's a daily meal for you?
I usually like to have something with like a carb or starch, like rice or pasta, and then a vegetable and the protein, like chicken.
Okay. All right. And what are some stressors in your life?
Definitely work. I'm working kind of a tough job. And then wedding planning, so that's a bit of a stressor.
Okay. How does that stress you out?
It's just a lot. Feel very overwhelmed at times.
Do you feel physically stressed or more mentally stressed?
Both. I sometimes have a difficult time eating. I clench my jaw a lot. There's a lot of just like muscle tension that I have in my neck and shoulders a lot of the time, so.
Okay. How do you cope with that?
I talk to my fiance. I think working out is a way that I cope as well.
How often do you work out?
I try to work out like 3 or 4 times a week.
Do you feel that helps you?
Oh yeah, I always feel better after I work out.
How do you think that helps you?
I think it's a way for me to just like let go of the stress.
Okay. Alright. So do you have any allergies that you know of?
Not that I know
Okay. Any hospitalizations?
of. I was hospitalized once for some problems with my lymph nodes. They couldn't figure out what was wrong, but they did do a biopsy. And that was kind of it. And then I have gone to the ER for irregular menstrual bleeding.
Okay. With that lymph node biopsy, did they ever have any results?
They weren't able to find anything conclusive,
Okay.
so I have no idea what caused that.
Has that lymph issue come up recently
Nope,
that you know of?
nope. Last time was about 4 years ago.
Okay. Any childhood illnesses?
Nope.
Okay. Are you current on your immunizations?
Yes,
Okay. You got the flu shot?
I did.
Okay. Have you got also the TB and tetanus shot?
Yes.
Okay. Any chronic issues that you know about?
Just some mental health stuff.
Okay. What kind of mental health stuff?
Just depression and anxiety. I've struggled with those since I was 9.
Do you currently take any medications for that?
Not currently. I have in the past.
And what medications are you on right now?
Right now I just take a multivitamin and then sometimes melatonin at night.
Any accidents or traumas?
Nope.
And what is your OB history like?
I've never been pregnant before. I have had some like irregular menstrual bleeding, but that's it.
And you said that it did bring you to the ER.
Yeah.
Has that been something that's happened more than once?
No, it was just that one time. It was while I was switching birth control methods. And I haven't had any problems since then.
Okay. Looking at your family history now, any family history of heart disease?
Yes, on my mom's side.
Any of those family members die of a heart attack or heart-related issues?
I know that both of my great grandmothers on my mom's side, and then some of my great aunts on my mom's side have had heart attacks.
Okay. Do you know if that caused a death, or they just had them and you don't know anything else?
Oh, for the great aunts, they're still around. They just had heart attacks, and
Okay.
they're fine now. But the great grandmothers, heart disease killed both of them.
Okay. All right. What about cancer?
Melanoma on my mom's side as well.
Now, has that killed any family members?
Nope.
Diabetes?
Nope.
No diabetes. Any respiratory issues?
Not that I can think of.
Okay. Smoking history for the family?
Yeah, a lot of people on my dad's side of the family previously smoked, and some still do.
Drug abuse?
Yes, on my dad's side.
Trying to think of other pertinent family ones. Heart disease is usually the main one. Cancer is up there as well. That's about it. So, looking at your family system, do you feel supported?
Um, in my family, yes.
Tell me a little bit about that.
I definitely think I can go to my mom, and my sisters if I need anything. They're living pretty far away right now, so I don't get to see them as much or use them as much as I would like, but I'm still close to them.
Okay. Any other support systems that you reach out to?
Definitely my fiance, and then some of my friends, but they also live far away, so locally I really don't have much of a support system.
Do you feel like that's an issue?
Sometimes, yeah.
How?
It definitely adds to some of my anxiety and stress, and then it's just kind of hard.
What's your current living situation like?
I'm living in an apartment with my fiance.
How is that going for you?
It's going really well. I like the place. I like living with him. I think it's good.
What do you do for a job?
I'm a mental health counselor.
And I'm sure that has some stress.
Yes.
Do you like your job?
I like the work I do. I'm in the middle of transitioning to a private practice role at the moment, so hopefully that'll come with a little less stress.
Okay. Are you currently sexually active?
Yes.
And what's your financial situation like?
It's pretty good. For having student loans and paying for a wedding, I'd say we're pretty good.
That's good. Do you drink?
Socially.
How What would you say is socially to you?
I'd say maximum twice a month. And then in terms of drinks per sitting, usually 3 or 4.
Okay. Are you a smoker?
No.
Have you ever been a smoker?
I smoke cigarettes, like, again, socially, just, in the past when I've been drinking, but I haven't in quite some time.
When's the last time, would you say?
Probably like 5 years ago.
And any illicit drugs or recreational drugs?
Marijuana.
So looking at just reviewing,
Mhm.
systems, have you had any drastic weight changes recently?
No.
Any unknown fatigue or fevers?
I mean, I've been really tired, but I don't, I can explain that with my work schedule.
Okay, okay. Any skin issues, rashes, lumps, bumps, anything you've noticed that's abnormal for you?
No.
Any headaches?
I have been getting some headaches lately.
Okay. Are they frequent? Do they come and go?
I guess it kind of depends on the day. Sometimes it'll just be like a dull headache that lasts all day. Sometimes my head hurts so bad that I kind of lose vision a little bit. Just kind of depends on the day. But the other really bad headaches only happen about once or twice a month.
How often do you drink caffeine?
Every day.
How much caffeine?
Oh gosh. At least 3 caffeinated drinks. I think it ends up being around 500 milligrams a day.
Okay. Do you feel with your caffeine consumption, either if you haven't been consuming enough caffeine or you're trying to wean yourself off, does that contribute to the headaches?
Oh yeah, definitely.
Okay. And with going back to the one about the blurred vision, how soon did it resolve?
A couple of hours.
Did you need medical attention?
No.
Any vision changes recently?
My vision's gotten worse recently, but it's kind of been steadily getting worse since I was about 8, so.
Do you see an ophthalmologist regularly?
Mm-hmm.
When's the last time?
August.
Any ringing in the ears?
No.
Any ear infections, ear aches,
No.
drainage?
No.
Any colds recently? Sinus colds?
Not recently.
Any lumps or swollen lymph nodes in the neck?
Nope, not recently.
Any achiness, tenderness?
Nope.
Any breast discomfort, lumps, bumps, irregularities that you've noticed?
Nope.
Any cough, shortness of breath, wheezing?
Nope.
Any chest pain, chest discomfort, any palpitations, like it feels like your heart's beating out of your chest?
My chest sometimes feels tight when I'm feeling anxious, but that's about it.
Any appetite changes?
It's decreased lately.
What do you think, or why do you think that is?
I definitely think it's stress related. When I get very stressed, my appetite tends to drop.
Okay. Nausea, nausea or vomiting, heartburn,
Nope.
change in your bowel habits. Are you going regularly?
No, I tend to be pretty constipated. Don't go very frequently.
What would you say your normal is?
Oh gosh. gosh, once every 4 or 5 days.
Do you take anything to help?
Every once in a while I'll take a laxative.
Okay. Have you ever seen a doctor for that issue?
No.
Alright, let's see, any, anemia or feeling dizzy, any bleeding, new, bruise areas that are unexplained?
Sometimes I'll feel dizzy. You know, sometimes it just kind of comes when I'm sitting down, sometimes it's when I'm standing up. But I do experience dizziness sometimes.
Okay. Any history of low blood pressure?
Yeah, my blood pressure tends to run pretty low.
And you said you work out, so that's not uncommon. Someone who's active. Looking at your OB history, currently on contraceptive.
I have the Mirena IUD.
Okay. Do you feel like your periods are regular?
I don't get periods with the Mirena.
Okay. Any unusual cramping or spotting?
I'll sometimes have spotting and cramping, but not too often. My gynecologist told me that was kind of normal.
Okay. When was your last period?
Probably a couple months ago, after I first got the Mirena.
When you transition?
Yeah.
Okay. Any numbness, tingling in your fingers or toes?
No.
Anywhere else? Face?
No.
No. When you stand up, you said you get dizzy sometimes. Do you feel like this is a persistent issue, or does it go away?
No, it goes away. It's not all the time. It's just sometimes.
When you do stand up, do you have to ever sit back down?
That's happened a handful of times, but not usually.
What about balance issues?
No, balance is usually pretty good.
Okay, and your psych history. So you said you suffer from anxiety and depression,
Yeah.
and you've seen someone for this. Okay. Did they prescribe you anything?
Yeah, so in the past I have been prescribed Celexa, Prozac, and Zoloft.
Okay. And do you feel like those worked for you?
Not really. It kind of seemed like things were always just fine. They never really worked well.
Do you feel like it's better now or when you were on the medication?
I think it's better now from when I was on my last medication, which is Zoloft.
Okay.
Yeah, I think that made things a little bit worse.
Any suicidal thoughts?
Not now, not recently.
And do you have any issues peeing?
No.
Are you, do you feel like your bladder's never empty or you have to go multiple times or at night?
No.
No? Okay, well I think that's all the questions I have for you now. I think we'll move on to the physical exam.